Hello my dear friends, I am Wani Rafi PG scholar at Sher Kashmir Institute of Medical Sciences Soura Srinagar. Dear friends, my today's online class is on the topic anemia. This class will be beneficial for BSc nursing students, BSc OT students, GNM students, FM and MM PHW students as well as for all other allied diploma holders. Let us have introduction about the topic. Do you know friends, anemia is a major killer in India? Also statistics reveal that every second Indian woman is anemic. 1 in every 5 maternal deaths is directly due to anemia. Anemia affects both adults and children of both sexes, although pregnant women and adolescent girls are most susceptible and most affected by this disease. Now let us define what is anemia. Do you know friends, anemia is derived from the term an, which means without, and emia, which means blood. So anemia is decrease in the RBC count, hemoglobin or hematocrit values, resulting in a lower ability for the blood to carry oxygen to body tissues. इसका मतलब यही है, एनीमिया वो कंडीशन है जब हमारे ब्लड में आरबीसी का काउंट या हीमोग्लोबिन का काउंट या हम कह सकते हैं हेमाटोक्रिट वैल्यूज डिक्रीज होते हैं, which lead to lower ability for the blood to carry oxygen to blood tissues. हमारी बॉडी में क्या होता है, जो ब्लड होता है उसकी जो एबिलिटी होती है वो डिक्रीज होती है, वो lower होती है to carry oxygen to body tissues. Now you can see from the diagram, in first diagram there is normal amount of red blood cells in blood, and in second diagram there is anemic amount of red blood in the cells, or we can say less or decreased amount of red blood cells in blood. Now friends, let me briefly describe the mechanism for regulating the rate of erythropoiesis. Do you know what is meant by erythropoiesis? It is actually the process of formation of RBCs. And what is erythropoietin? It is the hormone which is secreted from the kidneys when there is reduced oxygen levels in the blood. Now first you see the diagram in a systematic way. Just see the diagram. Now I will explain you the cycle. As per the diagram, जब हमारी बॉडी में ऑक्सीजन लेवल कम होती है ब्लड में, तो उसकी वजह से एक स्टिमुलस जनरेट होता है. स्टिमुलस जब जनरेट होता है उसके साथ साथ हमारी बॉडी में हाइपोक्सिया होता है. वी फील लेक ऑफ ऑक्सीजन. हाउ वी फील लेक ऑफ ऑक्सीजन? क्योंकि हमारा जो आरबीसी काउंट होता है वो डिक्रीज होता है. जब वो डिक्रीज होता है देयर इज़ डिक्रीज्ड अवेलेबिलिटी ऑफ ऑक्सीजन, और उसकी वजह से जो हमारे टिश्यूज़ होती हैं उनमें ऑक्सीजन की डिमांड बढ़ जाती है. जब ऑक्सीजन की डिमांड बढ़ जाएगी तो उसकी वजह से क्या होगा, ऑक्सीजन लेवल ब्लड में कम हो जाएगी. जब वो कम हो जाएगी तो किडनीज स्टिमुलेट होती है. जब वो स्टिमुलेट होती है तो वहाँ से एक हार्मोन निकलता है, उस हार्मोन को हम बोलते हैं एरिथ्रोपोइएटिन. जब वो हार्मोन निकलता है वो स्टिमुलेट करता है बोन मेरो को या रेड बोन मेरो को, जो बोन्स में होती है. रेड बोन मेरो इज़ प्रेजेंट इन द बोन्स, स्पेशली इन लॉन्ग बोन्स जहाँ पे ज़्यादा एरिथ्रोपोइएसिस होती है. तो जब बोन मेरो एक्टिवेट होती है, स्टिमुलेट होती है, वहाँ से ज़्यादा प्रोडक्शन होती है आरबीसीज की या एरिथ्रोसाइट्स की. तो या हम बोल सकते हैं एनहांस्ड एरिथ्रोपोइएसिस ऑकर्स. जब ज़्यादा आरबीसीज प्रोड्यूस होती है तो बॉडी में क्या होती है, देयर इज़ इंक्रीज्ड ऑक्सीजन कैरिंग एबिलिटी ऑफ द ब्लड. तो पहले जो कंडीशन थी जब ऑक्सीजन कम हुआ था ब्लड में, तो उसको रेस्टोर किसने किया? इस साइकिल ने, इस प्रोसेस ने। तो इसमें मेन कौन सा हार्मोन यूज होता है? दैट इज एरिथ्रोपोएटिन, यू शुड नो इट, इट इज सिक्रीटेड फ्रॉम द किडनीज। एंड व्हाट इज दिस प्रोसेस कॉल्ड? दिस प्रोसेस ऑफ फॉर्मेशन ऑफ आरबीसीज इज कॉल्ड एरिथ्रोपोएसिस। और ये जो पूरा है ये हमें यूज होता है when there is any alteration, yeah, when there is decrease in normal blood oxygen levels in our body. Now friends, let us see what is pathophysiology of anemia. सबसे पहले there occurs decrease in RBCs or decrease in hemoglobin level or decrease in hematocrit level. उसके बाद क्या होता है? diminished oxygen carrying capacity होती है हमारी बॉडी में। उसके बाद हाइपोक्सिया होता है। हाइपोक्सिया इंड्यूस्ड इफेक्ट्स ऑन ऑर्गन फंक्शन, जो लेटर ऑन में आपको बोलूँगा क्या क्या होता है इसकी वजह से। उसके बाद साइंस एंड सिम्टम्स ऑफ एनीमिया विच आई विल डिस्कस लेटर ऑन इन द क्लास। सो ब्रीफली यू कैन सी इन द डायग्राम व्हाट इज पैथोफिजियोलॉजी ऑफ एनीमिया। नाउ what are the normal values of hemoglobin in our body for various categories? For example, for men it is greater than 13 gram per deciliter. For women it is greater than 12 gram per deciliter. For pregnant women it is greater than 11 gram per deciliter. For infants from 2 to 6 months it is 9.5 gram per deciliter. For children from 6 months to 24 months it is greater than 10.5 gram per deciliter. From 2 years to 11 years it is greater than 11.5 gram per deciliter. And among children from 12 years, or we can say from 12 years onwards, it is greater than 12 gram per deciliter of the blood. This is just for your knowledge. You can note it down. What is the normal value of hemoglobin? Dear friends, let us see the classification of anemia. There is a two-way classification. First is on the basis of cause. Second is on the basis of morphology, or we can say shape of RBCs. On the basis of cause, we classify them as: first is anemia due to blood loss, second is anemia due to inadequate production of normal blood cells, and third is anemia due to excessive destruction of blood cells. And on the basis of morphology or shape of RBCs, we classify them as normocytic, microcytic, and macrocytic. I will explain these all in coming slides. Now, types of anemia. On the basis of clinical picture, the types are iron deficiency anemia, megaloblastic anemia, pernicious anemia, hemorrhagic anemia, hemolytic anemia, thalassemia, sickle cell anemia, and aplastic anemia. Now friends, let me explain these all one by one. First is iron deficiency anemia. It is due to excessive loss of iron. For example, women are at greater risk because they are having menstrual cycles, or during pregnancy there is growing fetus, which leads to loss of iron and further leads to iron deficiency anemia. Second is megaloblastic anemia. It is due to less intake of vitamin B12 and folic acid. You all know vitamin B12 and folic acid are essential precursors for having normal process of erythropoiesis or formation of RBCs. Also, red bone marrow produces abnormal RBC, for example during cancer drugs or chemotherapy. Another is pernicious anemia. It is inability of stomach to absorb vitamin B12 in small intestine. When there is inadequate absorption of vitamin B12 in small intestine, then there occurs pernicious. Another is hemorrhagic anemia. Hemorrhagic means anemia due to hemorrhage, means loss of blood, loss of RBCs. It can be through bleeding, it can be through stomach ulcers or menstrual cycles. Another is hemolytic anemia. Hemolytic means when there is rupture in plasma membrane of RBCs. It may be due to parasites, toxins or antibodies. Another is thalassemia. इसमें क्या होता है? इसमें होता है less synthesis of hemoglobin. Usually it is found in the population of Mediterranean Sea. Another is sickle cell anemia. इसमें क्या होता है? ये हेरिडिटरी ब्लड डिसऑर्डर है. जो ब्लड सेल्स होती है उनमें एबनॉर्मल शेप होती है. यूजुअली दे आर हैविंग द शेप ऑफ सिकल. Aplastic anemia is destruction of red bone marrow. It can be due to toxins, gamma radiation, etc. Now types of anemia on the basis of morphology. We can say shape of the cell. First is normochromic normocytic anemia. इसमें क्या है? Anemias of chronic disease, hemolytic anemias, those characterized by accelerated destruction of RBCs, and anemia of actual hemorrhage. We can also say aplastic anemias, those characterized by disappearance of RBC precursors from the marrow. Second is hypochromic microcytic anemia, that is iron deficiency anemia, thalassemia or anemia of chronic disease. Third is normochromic macrocytic anemia. इसमें क्या है? विटामिन B12 deficiency or folate deficiency. You can see from the diagram hyperchromic, normochromic and hyperchromic on the basis of shape of the RBC. You can see from the diagram hyperchromic, normochromic and hypochromic. Now risk factors. Risk factors are poor socioeconomic class. जितनी एक फैमिली पुअर होगी उतना उनका जो न्यूट्रिशनल स्टेटस होगा वो पुअर होगा. दे विल बी हैविंग इनएडिक्वेट न्यूट्रिशन, उसकी वजह से एनीमिया होता है. मल्टीपैरिटी, टीनेज प्रेगनेंसी, मेंस्ट्रुअल प्रॉब्लम, इन सब की वजह से क्या होता है? एनीमिया. दीज आर रिस्क फैक्टर्स. These factors lead to anemia: poor socioeconomic class, multiparity, teenage pregnancy and menstrual problem. Now what are the causes of anemia? First of all, there is increased requirements. इसमें क्या क्या है? Menstruating females, pregnancy, lactation, growing infants and children, erythropoietin treatment. Second is increased loss, GI bleeding, menorrhagia, persistent hematuria, intravascular hemolytic anemias, regular blood donors, parasitic infection. Third is decreased intake, vegetarian diet, socioeconomic factors. Fourth is decreased absorption. इसमें क्या है? upper GI pathology, for example celiac and Crohn's disease, gastrectomy or medications, for example antacids, Zantac, etc. What are the signs of anemia? Symptoms. Common symptoms of anemia are easy fatigue and loss of energy, unusually rapid heartbeat, particularly with exercise, shortness of breath and headache, particularly with exercise, difficulty concentrating, dizziness, pale skin, leg cramps, insomnia. These are the common symptoms of anemia. Now symptoms related with iron deficiency anemia. People will have hunger for strange substances such as paper, ice or dirt, which is called a pica. Upward curvature of nails. There will be soreness of mouth with cracks at the corners. Symptoms related to vitamin B12 deficiency. इसमें क्या होता है? There will be tingling, pins and needle sensation in the hands or feet. They will have lost sense of touch. There will be a wobbly gait and difficulty walking, clumsiness and stiffness of arms and legs. There will be dementia, hallucinations, paranoia and schizophrenia. Now signs of anemia are brittle nails, spoon-shaped nails, atrophy of papillae of the trunk, angular stomatitis, brittle hair, dysphagia and glossitis, Palmer-Vinson or we can say Kelly-Patterson sign. See from the diagram, paleness of eyes, atrophy of the papillae of tongue, upward curvature of nails or brittle nails, paleness on the skin. You can see from the diagram. Dear friends, you can see from the diagram what are the symptoms of anemia in different systems of the body. In eyes there can be yellowing, in skin there can be paleness, coldness, yellowing. In respiratory system there can be shortness of breath. In musculatory system there can be weakness. In gastrointestinal system there can be changed stool color. In central nervous system, due to anemia there can be fatigue, dizziness, fainting. In blood vessels there will be low blood pressure. In cardiovascular system there can be palpitations, rapid heart rate, chest pain, angina, there can be heart attack. And in spleen there will be enlargement due to anemia. You can see from the diagram. Wherever it is written in red, it means there is severe anemia. Means fainting, chest pain, angina, heart attack. These all things occur in severe anemia. Now friends, let us see what are the investigations that are done to diagnose. There are two parameters, one is quantitative, another is qualitative. In quantitative we see volume of packed cells, that is hematocrit, which I will explain you in next slide. Another is hemoglobin concentration, and third is red cell concentration per unit volume. In qualitative parameters there is mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration. Now let me explain. What is hematocrit? It is packed cell volume. It means it is the proportion of the volume of blood sample that is occupied by RBCs. In men it is 42 to 52% and in women it is 36 to 48%. Now what is cell volume hemoglobin concentration? It is the amount of hemoglobin per unit volume of blood. In women it is 12 to 16 grams per deciliter and in men it is 14 to 17 grams per deciliter. Third one is red cell count, total number of red blood cells per unit volume of blood sample, or we can say number of RBCs per cubic mm. In men it is 4.2 to 5.4 into 10 raised power 6 per mm cube, and in women it is 3.6 to 5.0 into 10 raised power 6 per mm cube. Now what are the three investigations here? First is hematocrit, which is also called packed cell volume. Second is cell volume hemoglobin concentration. Third is red cell count. You can note the parameters. Now friends, another investigation is mean corpuscular volume. It is the average volume of RBC. It is denoted by small f capital L, and the normal parameter is 82 to 98 mm cube. Another is mean corpuscular hemoglobin. It is the average hemoglobin content per RBC, and the normal value is 27 to 31. It is denoted by the unit small p capital L. And another is mean corpuscular hemoglobin concentration. It is the average concentration of hemoglobin in a given red blood cell volume. It is measured in grams per deciliter, and the normal parameter is 32 to 36 gram per dl. So what are another three investigations? It is mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration. Now, what is management for anemia? It is the main portion. As per the nursing students are concerned, this is the main portion of this topic. First of all, care objectives. We have to determine the cause of iron deficiency. The etiology is often multifactorial. Even when there is an obvious cause, investigation of serious underlying causes, for example cancer in adults, is recommended. Second is aim of treatment. That is normalize hemoglobin levels and red cell indices, replenish iron stores, individualize disease-specific management depending on underlying cause. Third is lifestyle management. It is recommended that patients with iron deficiency receive dietary advice. So what are first three care objectives? First is determine the cause of iron deficiency. इसमें हम देखते हैं कि आयरन डिफिशिएंसी जो है उसका कॉज क्या है. सेकंड इज एम ऑफ ट्रीटमेंट. We try to normalize hemoglobin levels. And third is we try to manage the lifestyle. It is recommended that patient with iron deficiency receive dietary advice. जिनमें आयरन डिफिशिएंसी होती है उनको हम डाइटरी एडवाइस देते हैं. What is non-pharmacological management of anemia? First of all, tea and coffee inhibit iron absorption when consumed with a meal or shortly after meal. Vitamin C is also a powerful enhancer of iron absorption from non-meat foods when consumed with a meal. The size of vitamin C effect on iron absorption increases with the quantity of vitamin C in the meal. Third is germination and fermentation of cereals and legumes improve the bioavailability of iron by reducing the content of phytate, a substance in food that inhibits iron absorption. Promote and support exclusive breastfeeding for about 6 months followed by breastfeeding with appropriate complementary foods including iron rich through the second year of life. इसमें यही है कि मील के बाद या मील से पहले we inhibit taking tea or coffee. Why? Because they inhibit iron absorption. Second, we should increase the content of vitamin C in our diet because vitamin C helps in iron absorption. Third is we promote germination and fermentation of cereals and legumes क्योंकि उसकी वजह से क्या होता है, there is decreased content of phytate, that is a substance in food that inhibits iron absorption. Third is we promote exclusive breastfeeding for 6 months. After that we start weaning process. What is weaning? Weaning is having breastfeeding and also complementary foods including iron rich through the second year of life. And what is the recommended dietary allowance of iron for various categories? It is 8 mg for adult men per day, and for women adult aged 50 onwards it is 8 mg. For adult from the age of 19 to 50 it is 18 mg. For pregnant ladies it is 27 mg per day. For lactating mothers it is 9 mg to 10 mg per day. For adolescents in the age group of 9 to 18, for girls it is 8 mg to 15 mg. For boys it is 8 mg to 11 mg. And for children birth to age 4 to 8 years it is 10 mg. For infants 7 months to 1 year it is 11 mg per day. And for infants birth to 6 months, kindly note it, for infants from birth to 6 months it is 0.27 mg per day. Now management for complementary parasite control measures. हम क्या करते हैं? We will give anti-helminthic therapy with 400 mg of single dose of albendazole to eliminate hookworms before the initiation of iron and folic acid therapy. सबसे पहले हम क्या करते हैं? we give antihelminthic therapy. वो कितना होता है 400 mg ऑफ सिंगल डोज ऑफ एल्बेंडाजोल। उसके बाद हम उसको देते हैं आयरन एंड फोलिक एसिड थेरेपी। फॉर एग्जांपल इन चिल्ड्रन greater than 2 years we will give 200 mg per day single dose. If there is pregnancy, albendazole is contraindicated in first trimester and it can be administered in second or third trimester. This is management for complementary parasite control measures. तो याद रखना, फर्स्ट वी विल गिव एंटीहेलमिंथिक थेरेपी 400 mg सिंगल डोज ऑफ एल्बेंडाजोल। उसके बाद हम स्टार्ट करते हैं उसको आयरन एंड फोलिक एसिड थेरेपी। बच्चों में कितना देते हैं हु आर मोर देन 2 years old, we will give 200 mg per day single dose of albendazole, and in pregnancy albendazole is contraindicated in first trimester and can be administered in second or third trimester. And dear friends, what is treatment for 6 to 12 months? It is dosage of 12.5 milligram iron plus 50 microgram folic acid daily for both normal birth weight category and low birth weight category, and duration for these two is, for first one it is 6 to 24 months of age, and for the second one it is 2 to 24 months of age. Kindly remember the dosage. It is 12.5 milligram iron plus 50 microgram folic acid daily. Now friends, what is treatment of mild and moderate anemia? Now if a group is having children from 2 to 5 years, the dosage is 20 to 30 milligram iron per day. For children having age from 16 to 11 years, the dosage is 30 to 60 milligram iron per day, and for adolescents and adults the dosage is 60 milligram iron per day. After then, anemia will correct within 2 to 4 months if appropriate iron dosages are administered and underlying cause of iron deficiency is corrected. After that, we have to continue iron therapy for an additional 4 to 6 months after the hemoglobin normalizes to replenish the iron stores. Now treatment of severe anemia. For age group of greater than 2 years, the dosage is 25 milligram iron plus 100 to 400 microgram folic acid daily, and it is given for the duration of 3 months. And if there is age group from 2 to 12 years, then we have a dose of 60 milligram iron plus 400 microgram folic acid daily, and it is given for 3 months duration. And if the age group is adolescents and adults including pregnant women, then dosage is 120 milligram iron plus 400 microgram folic acid daily, and it is given for the duration of 3 months. After completing 3 months of therapeutic supplementation, pregnant women and infants should continue preventive supplementation program. Kindly note this point. After completing 3 months of therapeutic supplementation, pregnant women and infants should continue preventive supplementation program. Treatment of pregnant women having anemia. If there is prevalence of anemia in pregnancy greater than 40% in population, then dose is 60 milligram iron plus 400 microgram folic acid daily, and the duration is 6 months in pregnancy and continuing to 3 months postpartum. Kindly note this. In pregnancy, if there is prevalence of anemia in pregnancy greater than 40% in population, तब डोज कितना होता है 60 मिलीग्राम आयरन प्लस 400 माइक्रोग्राम फोलिक एसिड डेली. The duration is 6 months in pregnancy and continuing to 3 months postpartum. Also, iron absorption may be decreased by antacids or supplements containing aluminium, magnesium, calcium, zinc, proton pump inhibitors. इनकी वजह से भी आयरन एब्जॉर्प्शन डिक्रीज होती है, जिसमें क्या है एंटी एसिड से या प्रोटॉन पंप इनहिबिटर से मैग्नीशियम, जिंक, अल्युमिनियम एटसेट्रा. Also, space administration effort by at least 2 hours. Oral iron preparation may cause nausea, vomiting, dyspepsia, constipation, diarrhea, dark stools. Strategies to minimize these effects include: start at a lower dose and increase gradually over 4 to 6 days, giving divided doses or lowest effect dose, or taking supplements with meals. Although sustained release iron preparations tend towards less gastrointestinal side effects, they may not be as effective as standard film coated products due to reduced poor iron absorption. Kindly note these points. हमें कितनी स्पेस एडमिनिस्ट्रेशन रखनी है? एट लीस्ट 2 आवर्स. आयरन ऑरल आयरन प्रिपरेशंस की वजह से क्या होता है? नौशिया हो सकता है, वॉमिटिंग, डिस्पेप्सिया, कॉन्स्टिपेशन, डायरिया, डार्क स्टूल्स. और वन मोर इम्पॉर्टेंट थिंग इज start at a lower dose and increase gradually over 4 to 6 days. पहले हमें छोटे छोटे डोजेस में देना है, फिर इंक्रीज ग्रेजुअली करना है, या हमें सप्लीमेंट्स लेने हैं between the meals or with meals. Thank you friends for tolerating me for half an hour. I tried my best to simplify the content of the class so that every student will grasp easily. You are always welcome to suggest me for modifications and rectifications for future classes. Thank you friends. Best of luck. Stay blessed.